just wanted to make a quick video to talk about a couple of things. First thing to talk about is the topic paper. Getting some questions about the topic paper, and what should you choose. With this particular assignment, I wanted to give you a lot of latitude, have you use some creativity in picking really anything that you may be remotely interested in for this paper, since you do have to write a few pages on it. The only thing that really is the requirement is it's related to sectional imaging, viewing the body within sectional images, or 3D imaging as well. And by default, that usually means you're dealing with either CT or MRI as the modalities. You don't necessarily have to focus on a modality, but you can. You don't necessarily have to focus on a particular procedure, but you can. So, for example, I just tried to think of some ideas here about, topics. And again, you don't have to pick from this list. I'm just going to kind of throw these out here as kind of get the creative ideas going. But one of the things that you could do is, let's say, the future of CT involved with cardiac scoring. It's kind of an up-and-coming trend, whether they should use cardiac scoring and how CT is involved with that. Could be just a paper just generally overviewing that process, or you can get into some depth if you like and compare and contrast, whether you should use some sort of cardiac cath versus cardiac CT scoring. Perfectly fine, as long as the paper has, again, something to do with sectional imaging or 3D imaging, which is actually rendered from that sectional data. So that's all good there. Another one kind of scribbled out here is maybe you want to focus on trends within imaging of the knee using MRI. Again, you could focus on a body part, you could focus on a modality. That particular topic kind of looks at both, but again, just an idea. Another one is imaging implications using high slice CT technology. High slice, pretty much anything 128 slices or greater. Now, you may be like, you have no idea what that even means. Maybe you write a paper on what CT high slice is all about, what these new modalities that are coming out. 128 is actually starting to become common, but you could talk about why we view the body in 128 slices or have scanners with that capacity and what the advantages are. Again, that's directly related to sectional imaging. It does, again, by default, has to tie in a modality, in this case CT. We had a student a couple of semesters ago, and she wrote a really interesting paper. I thought this was kind of creative, and it was imaging mummies. Occasionally you hear about these Egyptian mummies that are 2,000 years old, and they'll run them through a CT scanner. This way they can preserve the body. They don't need to destroy the mummy by unwrapping it, and they can determine some things, maybe even cause of death. So that was kind of cool. It's interesting. Is viewing the body in three dimensions and in sectional images, and involves something pretty much, totally outside the normal box of medical imaging. So I thought that was kind of neat. We've had papers that have focused on maybe specific disease processes, just the modality used to view, celiac disease. So again, you could focus on any of these areas, whether it's the modality, the disease, some sort of external thing like mummies, a lot of different ways to take this. So, but here's the other wonderful thing too, is don't worry. Because the first thing that you need to do is you need to submit your topic to me. I'll review the topic. If there is any issues with it, then I'll let you know. Or if I don't see how it connects, I might ask you a few questions. And as long as you can show me how it connects, we're good with it. The purpose of this paper is really twofold. One is to get you kind of more embedded into writing a paper in medical imaging and finding those resources. The other one is the process of writing the paper and the resources available to help you write that paper. So maybe you might need the writing center for this first paper. Again, I'd highly encourage you to contact Clay. If this is your first big paper, you might need some help. Contact Clay in the writing center sooner rather than later. You do not expect to contact him the day before your paper's due, because he will not be able to help you. But if as you're going through this process, you can establish a relationship with our writing tutor if you need that kind of help. And please, again, do get that help if you need it. So then again, that's what kind of the paper's all about, getting you comfortable with this process before you go deeper into the program, and papers will become larger and more in depth. Kind of have a fun one with this one. The next thing I wanted to talk about was just to highlight a feature within the course, whether or not you guys know about it. So let's jump into the course real quick, and let me show you our CT scans that we're going to contain within just about every module. I'm going to have a CT scan for you. So, all right, so here we are. We are inside the course. Hopefully you are reviewing your course news. Do remember to kind of scroll down and make sure you look at all the course newses, because again, I use this a lot. It's our dynamic area where we talk and kind of chat, if you will. But let's go to content. And again, just a quick review, course overview. This is where you'll find the syllabus. I've had some questions on where the syllabus is located, and also some basics about the course and success techniques. All right, but let's go into our module 1, and then under your reading and presentation, you will find learning activities. And in this case, we've got a CT of the head in the bone window. Again, that windowing means that we're just able to bring out that fine bony detail. The soft tissue detail has faded away. So you will be doing bone window, of course, for any kind of bone trauma. The beauty about CT is that you don't rescan. You just simply alter your window and level to get to highlight certain anatomy. But once the scan loads, and this was a scan actually I pulled off the packs here and has stripped off all of the information, you hit play. The scan kind of loads here in a sort of a jerky fashion, but that's only through the first time around. It's loading through the scan, going slice by slice. And the way that you can use this is to sort of quiz yourself. You can look at the anatomy. You can take the video slider here and you can pan through. You can see how the anatomy changes as you go from inferior to superior. So kind of use it as a self-test. Are you able to have maybe the book in front of you is what I'd recommend. Have the book in front of you with the images, and match up the images that you see, the external auditory canal, the carotid canal. Can you see the maxillary sinuses? You see how those are going. I will say that I'll tell you what, here's what we'll do. And if you've watched this video to this point, this will be your bonus as well. As you're scanning through here, I want to show you something with this particular patient. And if you email me and you tell me what I'm going to tell you here right now, you'll get a 10-point bonus. So email me that in the patient's left mastoid air cells, they've got an infection. So as you see here, look at these air cells, nice and clear. Look at these, all gunked up. And that's actually not uncommon. Maybe this person had a very nasty ear infection that migrated over. You can even see that, of course, as CT, they are, laying down. They are in the kind of the supine position. You can see how these cells have become filled with fluid. So let me know that you saw the mastoid air cells with an infection on the patient's left side, and you will get the 10 extra bonus points. So, and again, play with this. It's very cool. Any questions, any comments? Again, never hesitate to contact me, and thank you for watching.